Hey, welcome to Socialism for All. Today's date is January 18, 2022, and this is our third and final for the day COVID-related article. This one's from The Guardian. It's from Friday the 14th, so just a few days ago, and the headline is Hospitals in half of U.S. states close to capacity as Omicron continues surge. Recently, we did an article, case study in Rhode Island, which some of the emergency physicians there were sounding the alarm, was facing really dire circumstances even before Omicron. And then, of course, not so good afterwards. So this is basically variation on a theme, except not just focused on Rhode Island. So tagline, in 24 states, at least 80% of staffed hospital beds were occupied, as the Omicron variant has triggered a record number of COVID cases. This article is by Adam Gabbett and Oliver Laughlin. So, hospitals in nearly half of U.S. states are nearing capacity, according to the Department of Health and Human Services, as the Omicron variant has triggered a record number of cases across the country. In 18 states, at least 85% of adult intensive care unit or ICU beds were in use, while in 24 states, at least 80% of staffed hospital beds were occupied, HHS data shows. Alabama, Missouri, New Mexico, Rhode Island, Texas, and Wisconsin are among the states suffering a particular shortage of ICU beds. In Texas, which this week set a new record for COVID-19 cases reported in a single day, with 75,817 total new cases, more than 92% of ICU beds are occupied. According to HHS, 34.3% of those beds occupied by COVID-19 patients. In Wisconsin, 90.6% of ICU beds are occupied, 41.4% of those with COVID-19 patients. Rhode Island and Alabama each has more than 91% of ICU beds occupied. The New York Times first reported on the HHS data. The South has been hit particularly hard by the new variant, with states continuing to report record case numbers amid serious concern around hospital staff shortages. On Thursday, Joe Biden said that 1,000 members of the military will be dispatched to help mitigate staffing crunches at hospitals across the country, with many facilities struggling because their workers are in at-home quarantines due to the virus at the same time as COVID-19 cases have surged. Comment: what a gigantic fucking failure this government has been demonstrating, particularly since Biden took office, telling people to take their masks off, cutting benefits, just acting like everything's normal. As we just covered in the last article, they were about to dismantle the pandemic task force at the CDC just prior to Omicron hitting. You can't wish this thing away. And yet, seems that that's exactly what they're doing. The CDC cutting the isolation and quarantine guidelines in half. You don't need a negative test to rejoin the population after you're done isolating or whatever. And they're making people work sick, including hospital staff. I've talked to people who said that they went to get a test and the nurse administering the COVID test was COVID positive. So this is the kind of insane situation that they've gotten themselves into. We didn't need to have these policies. These are the policies they chose. The virus itself may be a natural disaster, a natural phenomenon, but absolutely this could have been handled differently with very different outcomes. This was not inevitable. This does not need to be happening. If they change what they're doing, then we would get a different outcome. And unfortunately, they're not going to change what they're doing because why? Class interests, capitalism. They need the economy to keep running. Joe Biden ran on this back to normal thing. And it's not just about him being a politician. It's who does he work for? He works for the 1%. That's the issue here. Continuing the article, the U.S. leads the world in the daily average number of new infections reported, accounting for 1 in every 3 infections reported worldwide, according to a Reuters tally. Data suggest cases may be beginning to plateau in New York and the East Coast after extraordinary surges. Timeout. Again, I think that this may be another sign of just trying to wish it away. Oh, it's peaking. It's peaking. It's like we're in the middle of it. You don't know if it's peaking yet. Jesus. It's just the fucking grasping desperation here. And it's just motivated by greed. It's this irresponsibility for what's happening. And it's like, oh, maybe it's over. Maybe it's over. It's like it just started. Seriously. I mean, maybe it is peaking, but we don't know. And I'm not about to listen to the same people that just basically got us into this situation. However, Texas has reported a test positivity rate of more than 35% over the past week. WFAA.com reported, as the Texas Department of State and Health Services said, quote, COVID has never spread this fast in the state. Comment. So test positivity rates, what's that? That's of all the tests being done, what percentage of them come back positive? 35%. So when we had the initial shutdown in spring of 2020, the guidelines for reopening was that your state would be under 5% test positivity for 2 weeks before you could reopen. That's what the World Health Organization recommended. We're now running states fully open at 35%. Yeah. So like I said, trying to just wish this away doesn't seem like it's working, and people who embrace that strategy lose credibility. As far as COVID has never spread this fast, that is correct, because Omicron is much more contagious than previous variants. You had first the Delta variant. I mean, well, you had original COVID, obviously. Then you had the Delta variant. That was the first major variant that became dominant. And now Omicron. And Delta was more contagious than the original, significantly so. And it was more severe. Like, the symptoms were more severe. And now Omicron comes out. And they keep saying that it's milder. It might be like marginally, like 10%, according to some of the studies that I've seen, somewhat milder in the acute phase. But that's not saying much. It's still more severe than original COVID, maybe slightly less so than Delta. But it's so much more transmissible than Delta or original COVID. It spreads so much more easily than Delta does, that the net effect on the healthcare system is much greater. So anyway, continuing. Alabama State, you can tell that this came from the UK. Alabama State reported a record, no one calls it that, a record number of children hospitalized with coronavirus this week. So Alabama had a record number of children hospitalized with coronavirus this week due to the highly transmissible Omicron variant. At least 60 children had been hospitalized, with 13 receiving treatment in intensive care. The state has recorded a number of record high cases throughout January, as officials continue to urge all those eligible to receive the COVID vaccine. Comment, yes, I will add, get the vaccine, get the booster if you've already had the vaccine and you're eligible. Usually it's 6 months after you've gotten your last dose of the initial vaccine. Do get it. I mean, it will reduce your odds of getting the worst symptoms, but that can't be the only thing that you do. And the U.S. running a herd immunity strategy plus vaccines is a really, really bad policy, as you can see by the results of Omicron. This isn't good. Continuing. State health officials told the Montgomery Advertiser that they were, quote, extremely concerned about the rise of hospitalizations among children and warned parents to get their children inoculated. Vaccination rates in Alabama also remain low, with just 48% of the population fully vaccinated. On Thursday, the Supreme Court blocked the Biden administration from enforcing a requirement that employees at large businesses be vaccinated against COVID-19 or undergo weekly testing and wear a mask on the job. Comment there. Everyone should be wearing a mask on the job, vaccinated or not. It's insanity that the Biden administration told people who were vaccinated to take their masks off, because you can still transmit it, and breakthrough cases are still a problem, even among the vaccinated. Also, for all the people whining and throwing fits about the vaccine mandate, just get the fucking test then. Just shut up about it. Like, you have this easy out of just get a weekly test, okay? Is it a big deal? Just get a test. Then you don't have to get the jab or whatever the fuck. And by the way, get the vaccine unless your healthcare provider specifically tells you otherwise because of something really specific to you as an individual. Get it. You're going to reduce your odds of putting a strain on the healthcare system, let alone on your own body. So, yeah. Anyway, but this whole thing that it's vax or mask, totally wrong. And that is coming from the, party of science, quote unquote, the Democrats. The court's conservative majority concluded that the administration overstepped its authority by seeking to impose the Occupational Safety and Health Administration, OSHA, vaccine or test rule on U.S. businesses with at least 100 employees. More than 80 million people would have been affected. Yeah, thanks, Supreme Court. Biden has pledged to deliver 1 billion free at-home test kits to Americans as a test kit shortage across the country continues to hamper efforts to control the Omicron variant. Biden said that a website where people can request tests will launch next week. By the way, I believe that that's up now, covidtests.gov. You can only get 4 per mailing address, and they arrive in 7 to 12 days, so stock up now, I guess, because put your orders in now because, by the time you have COVID, you can't wait because if you think you have COVID, then you order them, you're not going to test positive by the time the tests arrive. So you got to get them now. Anyway, just such a baffling, bizarre, frustrating experience, this entire thing. Yeah. So the other thing about that is, okay, you're giving people rapid at-home antigen tests. Will those cases be reported? You have more people testing at home. Is that going to cause the case numbers to look like they're declining when in fact people are just at home testing positive and then we never hear the outcome of that? I think that may be a possibility. I think that if you get a positive result, it's the best thing is to follow up with a PCR test. But I don't know that that's always possible for people because the availability of those also can be limited. So anyway, continuing. The White House said Friday that 500 million at-home rapid tests would be available to order on the 19th of January and would be mailed directly to American households free of charge. Quoting the White House Twitter, these 500 million tests are another way for Americans to access free testing, on top of 20,000 free testing sites, insurance coverage of lab-based and at-home tests, and 375 million at-home tests on the U.S. market this month alone. Tweets from January 14. In New York City, the number of new cases has flattened in recent days, the New York Times reported. Yeah, at a million cases a day, while New Jersey and Maryland have seen a slight decrease in the number of infections. Quote, every case is one too many, but if you watch the trend line, it looks like we may be cresting over that peak, Kathy Hochul, I'm not sure how to say her name, governor of New York, said in a briefing this week. Quote, we are not at the end, but this is a glimmer of hope when we desperately need that. Is it false hope, though? I mean, honestly, this thing just really started a couple of weeks ago. I mean, really. This is, I think, very premature. Anyway, that's the end of the article. But I don't know. You have a government that's trying to sell you hope, whether it's founded or not, vaxxed or masked. I mean, it's just been bungling this to a level that should not be acceptable to anyone. And you know what? I was going to do these in a separate video, but I think that they're actually appropriate to fold in now, a couple of other things that I had grabbed. So here's an article from Euronews. This is from January 7th. The headline is, Omicron is killing people and should not be called mild, World Health Organization warns. The article continues, the head of the World Health Organization warned on Thursday against describing the Omicron variant as mild amid a, quote, tsunami of cases overwhelming health systems across the world. Quote, last week, the highest number of COVID-19 cases were reported so far in the pandemic. Dr. Tedros Adhanom Ghebreyesus told reporters during a regular press briefing. The UN agency's latest weekly report showed that a record 9.5 million COVID-19 infections were reported across the world over the previous week, a 71% increase on the previous 7-day period. All regions reported a surge in the number of COVID-19 infections, with the largest increase, 100%, observed in the Americas, followed by Southeast Asia, 78%, and Europe, 65%. Yet, the WHO chief stressed that, quote, "We know for certain that this is an underestimate of cases because reported numbers do not reflect the backlog of testing around the holidays, the number of positive self-tests not registered," that's what I was talking about before, "and burdened surveillance systems that miss cases around the world," unquote. Omicron, first detected in South Africa in November, has been blamed for the latest wave. The variant was designated of concern by the WHO because studies show that it is more transmissible and more resistant to treatment than other variants, including Delta, with people more likely to be infected or reinfected even when fully vaccinated. Dr. Tedros warned that, quote, "While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, this does not mean that it should be categorized as mild. Just like previous variants, Omicron is hospitalizing people, and it is killing people," he stressed. There were 41,000 lives lost to the disease last week, a 10% week-on-week rise, bringing the pandemic's total death toll to over 5.4 million deaths, according to the WHO's update. The African region is the only one, however, to have reported a weekly increase in new deaths, 22%, although Europe had the highest death toll with 22,817 fatalities. Quote, "The tsunami of cases is so huge and quick that it is overwhelming health systems around the world," Dr. Tedros said. Quote, "Hospitals are becoming overcrowded and understaffed, which further results in preventable deaths from not only COVID-19, but other diseases and injuries where patients cannot receive timely care," he added. The WHO chief reiterated that the vaccine remains one of the most effective tools against the pandemic, but deplored once more that access across the globe is so unequal. Quote, "At the current pace of vaccine rollout, 109 countries would miss out on fully vaccinating 70% of their populations by the start of July 2022, he said. Quote, "The essence of the disparity is that some countries are moving towards vaccinating citizens a fourth time, while others haven't even had enough regular supply to vaccinate their health workers and those most at risk. Booster after booster in a small number of countries will not end the pandemic, while billions remain completely unprotected," he emphasized. So that's a key point. We've mentioned that before in our COVID videos. Basically, you have some of the rich imperialist exploiting countries using up huge amounts of vaccine supplies just, because they want to keep this like bourgeois lifestyle of like, I could do whatever I want. I could go anywhere I want. Just, injecting the boosters like dose after dose. Meanwhile, around the world, even frontline healthcare workers haven't even gotten their first dose yet. And, are the imperialist countries doing anything to make sure that they can get those vaccines? No. They're, enforcing the patents, and it's just insane. Like, it's just insane. This pandemic is heightening all of the contradictions in the world system today, and hopefully bringing some to a breaking point. It is going to take mass uprisings, mass demonstrations, political strikes, work stoppages, you name it. It's going to take all of that for workers to bring the system to a halt and end it. So, continuing with the theme of imperialist, denial of this global problem, here's a tweet from Dr. Cecilia Tamori. She is Director of Global Public and Community Health at Johns Hopkins Nursing. She tweeted a few days ago, January 13, New York Times in strong competition with The Atlantic and Wall Street Journal in downplaying Omicron. Unmitigated transmission framed as good news, while military medical personnel deploy to multiple states because hospitals are overwhelmed. We have this right at the top. And quoting the New York Times, still, the beginning of the end of the Omicron wave, if it turns out to be real, would be very good news. It would mean that a milder variant, again, that's wrong, had become the dominant, and that's in the New York Times, and they're publishing this. Don't trust the New York Times, like seriously. I don't know if anyone listening to this does, but I mean, It's infuriating to me. Anyway, it would mean that a milder variant, that's a lie, had become the dominant form of COVID, but was no longer causing a surge in cases and overwhelming hospitals. It would mean that tens of millions of Americans had built up additional immunity as a result of an Omicron infection. It would mean that the country would have taken a big step toward a future in which COVID is an endemic disease like the flu rather than a pandemic that dominates life. So there's a lot of problems with that. This is the first kind of explanation of no mask mandate that made any sense to me at all, although I still have like issues and questions with it. So basically, somebody suggested that the reason they haven't done a mask mandate is because they want people to get, quote, natural immunity. I mean, it doesn't work that way because even the natural immunity fades with time. And with new variants, which you're going to get in a, quote, herd immunity strategy, that natural immunity is going to be worth less and less. So, yeah, not a good strategy. Also, when they started doing the mask off policy was way before Omicron. So, I don't know. It really seems to me like the whole, vax or mask thing was political, came out of just, we need to go back to work and back to normal and all this kind of thing. What just amazes me is how everyone went along with it. Like everyone in medicine and public health went along with it because it absolutely was not indicated and is a large part of why we are where we are right now, why the Delta wave got so big before the Omicron wave started. I mean, just really, could no one stand up to this at any level anywhere? I mean, I'd like to hear from people who tried to speak out on it at the time because I didn't see a whole lot. Anyway, this New York Times thing, it's just total wishful thinking, bad science. They don't state any eugenics policies clearly but that seems to be driving some of this. It's just the system is getting gummed up and collapsing on itself at this point. Like they can't keep making new excuses for their own behavior quickly enough at this point. It's just not wanting to do the shutdowns that are necessary, not having an economy that is flexible enough because it is capitalist. It's driven by short-term profits and many, disparate owners of all these businesses who aren't going to comply and they're going to stage petty bourgeois fascist revolts against it. So you have a system that basically cannot coordinate properly and they're just trying to run with it. And it's going to be a disaster. It may be the end of this system, both of capitalism and of this, very decentralized U.S.-style government that is in place. Anyway, going on to the next tweet in the thread, note how the framing of mild and endemic is being used to accomplish this. Mild, despite numerous warnings, including from Dr. Tedros. And that was the article that I just read. The other thing about endemic, when you're having huge spikes from new variants, that is not endemic. Endemic is like, background noise, not giant spikes that completely overwhelm your system. So let's read this article, the next one, Endemic, same deal. This is from Reuters. WHO warns against treating COVID-19 like flu. And this is just a quick excerpt, January 11. The World Health Organization on Tuesday warned against treating COVID-19 as an endemic illness like flu rather than as a pandemic, saying that the spread of the Omicron variant has not yet stabilized. Spain's Prime Minister Pedro Sanchez said on Monday that it may be time to change how it tracks COVID-19's evolution to instead use a method similar to how it follows the flu, because its lethality has fallen. That would imply treating the virus as an endemic illness rather than a pandemic. Quote, we still have a huge amount of uncertainty and a virus that is evolving quite quickly, imposing new challenges. We are certainly not at the point where we are able to call it endemic, WHO's Senior Emergency Officer for Europe, Catherine Smallwood, told a press briefing. I agree. Dr. Tamori's thread continues. New York Times, January 13, front page for the record. Note the juxtaposition of the picture with the, quote, good news about peaking cases on the left. Military medical personnel deployment below that piece. So the middle picture is a National Guard member giving a coronavirus test in Ohio because they ran out of other staff. And then we got the, early signs suggest Omicron has begun to peak. And then right below it, 1,000 military medical personnel being sent to 6 states. Got another tweet there from Swaggering Toward Bethlehem. 1 week ago, Omicron is milder. Today, Biden sending medical teams to 6 states to help hospitals overwhelmed by COVID-19. So how much sense does any of that messaging make? It is entirely reflective of the wishes, anxieties, and other mental emotional byproducts of the class interests of the 1%. Speaking of the class interests of the 1%, here is a recent headline: Obama, it's time for all Americans to, quote, fight for our democracy. In the current context, this falls pretty flat. I said the USA, which won't even recommend wearing N95 masks during a COVID is airborne pandemic, thinks it can fight for democracy while its economy and infrastructure are ravaged by highly contagious Omicron, and hospitals are triaging ER and ICU patients on the daily with no end in sight. Current U.S. Vice President Kamala Harris was asked for her opinion, which was less than inspiring.
What point does the administration say, you know what, this strategy isn't working, we're going to change strategies? 6 former administration officials last week wrote that open letter urging the administration to change course, to change strategy. Is it time?
It is time for us to do what we have been doing, and that time is every day. Every day it is time for us to agree that there are things and tools that are available to us to slow this thing down.
That video kind of reminded me of another video.
Have you ever had a dream that you want him to do you so much you could do anything?
Anyway, honorable mention here goes to Bernie Sanders for at least trying to do something on the mask front. Here you see a chart. There was a version of this that was printed in the New York Times, actually. I'm happy to see anyone, whether it's Bernie or whoever, taking up the position that using N95, KN95 masks is going to be better in an airborne pandemic. You can see here, basically, down one side what one person is wearing, and then across the other side what another person is wearing. If both are not wearing masks, then the transmission time of COVID-19 is much shorter, and the better the quality of mask that both are wearing, the better the protection, all the way up to 25 hours if both are wearing N95 masks. Bernie, I believe, trying to introduce some legislation regarding beefing up the mask situation. Again, we're entering calendar year 3. These things are just being discussed here now. Meanwhile, in China, which has had one of the strongest pandemic responses of any country in the world, there are cases of Omicron now. And I read today that the Chinese government believes that the Omicron variant may have entered the country through the mail, like being on the surface of packages and things like that, though I'm not sure if that's been confirmed yet. Anyway, there's a picture here. Omicron outbreak in China sparks mass testing and lockdowns. This is from last week. I said about this is the only sensible response, not letting your country rack up 1.4 million Omicron cases in a single day, plus record hospitalizations, as the USA is doing. Where will the USA's social murder of its working class end? With mass demonstrations, student walkouts, strikes. Only this. By the way, if you're unfamiliar with the term social murder, this is a term coined by Friedrich Engels, Marx's longtime partner, to describe avoidable deaths which basically occur at the hands of the social system. And here we have 2 other tweets. This is a retweet by Naomi Wu of Sean Upton McLaughlin, who tweeted, all done, tested and home, but take a look at what Shenzhen was able to set up so quickly to test an entire office building. Very efficient. 5 minutes tops once you reach the line in the lobby. You can see the pictures there, people on the sidewalk. There are medical professionals with hazmat suits ready to test people, and boom, boom, done. They took care of it, and that's what a actually civilized country does. this is what you do when you're trying to maintain like a high level of functioning in your country amid a pandemic. So this is how it's done. The US isn't doing it. There's really no end in sight for the misery that the US is facing currently, at least in my view. I mean, again, unless the virus magically disappears, I think that this thing is probably going to drag on for some time. Hope I'm wrong, but honestly, we're entering the third year. We just got the, worst spike yet. And remember, most of the world isn't vaccinated. Most of the world is still struggling with this. Really, we have no reason to assume that it's just about to go away. So anyway, I've done 7 articles on COVID, or 7 videos rather. There are more articles within those videos in the last few days since Friday. I'm exhausted. It's depressing subject matter. I'm fully aware of this. I mean, it gave me kind of a headache doing those 4 in a row a few days ago. Then I took a couple of days away. Coming back, I'm like all burned out again. It's a horrible situation. So solidarity with everybody out there struggling to make ends meet while like weighing the threat of infection against, just trying to factor that into the already difficult decisions that we all were facing when it came to work and money and job and housing and relationships and everything like that. This is a terribly difficult time that capital is just making that much worse because it centers itself at our expense. Anyway, what do you think? Leave a comment or question below. We'll continue the discussion in the comments section. I'm sure this won't be our last COVID video. This is an ongoing crisis, although I will be switching to audiobooks and some other current events topics coming up. So keep an eye out for those. In the meantime, thanks for watching. Thanks to the current patrons whose names are on the screen. If you'd like to get your name on the screen, head to patreon.com/socialismforall. Every donation is encouraging. They're also materially helpful, so thank you very much for those. If you'd like to help out without making a donation, click like, subscribe, leave a comment, even if it's just good video or thanks, and share the videos on your social media. All of that helps to boost the channel and expand the audience and keep this conversation rolling, which really needs to happen. Entering the 2020s, I think that this needs to be a decade of actual socialist education because capitalism is getting less and less stable, and we really need to organize an opposition to it that is capable of mass mobilizations and really effective actions. So along those lines, back in the real world, join an organization or at least consider a donation to one if you're not ready to join right now. Try to find something in your area that is stable, has good politics, and is doing the kind of work that you can support. Organizations can look great on paper if they're actually dysfunctional in reality. That's not so good and can be a waste of your time. So try to find out as much as you can, see if they respond quickly, how often do they have meetings, can you attend a meeting, try it out, talk to people, etc. I recommend doing all of that because getting involved with a bad organization is really no fun. Or start a project of your own if you have the idea, the patience, the resources, and the comrades to help you get it started. We always like to see new projects popping up. Having that kind of good news is wonderful. Ultimately, whatever your contribution to the movement is, thank you for making it, and we'll catch you in the next video.